This video will show you how to flush your central venous catheter, or CVC. Your healthcare provider will tell you if you need to flush your CVC and when you should flush it. Follow their instructions. Before you get started, gather your supplies. You'll need one pre-filled 10 milliliter syringe with normal saline, one alcohol pad, and one disinfection cap for each lumen of your CVC. You'll also need a pair of non-sterile gloves. First, clean your hands. If you're washing your hands with soap and water, wet your hands, apply soap, rub them together well for 15 to 20 seconds, then rinse. Dry your hands with a paper towel and use that same towel to turn the faucet off. If you're using alcohol-based hand sanitizer, be sure to cover your hands with it, rubbing them together until they're dry. Next, put on the gloves. Pick up the pre-filled syringe and release the air bubbles by pointing the syringe up and gently tapping the side. Loosen but don't take off the cap. Press the plunger on the syringe until the air is pushed out. Then re-tighten the cap. Next, pick up one lumen and unclamp it. If it has a disinfection cap, take the cap off. If it doesn't have a disinfection cap, scrub the end of the needleless connector with an alcohol pad for 15 seconds. Then let it dry for 15 seconds. Take the cap off the syringe and throw it away. Make sure nothing touches the clean end of the needleless connector while you're doing this. Push the syringe into the needleless connector and twist it clockwise to the right until the connection feels secure. To do this, inject 1/3 of the saline. Then pause. Inject another third of the saline. Then pause. Inject the last third of the saline. Then pause. If you can't inject the saline, stop and check to make sure the lumen isn't twisted, blocked, or clamped. Then try again. If you still can't inject the saline, don't push harder. Remove the syringe, re-clamp the lumen, and call your healthcare provider. Once the syringe is empty, re-clamp the lumen. Untwist the syringe from the needleless connector and throw it away. Put a disinfection cap on the end of the needleless connector. Then check to make sure the clamp is closed. Repeat these steps for each lumen. Once you've flushed all the lumens, secure your catheter so it's comfortable and won't be pulled. Your healthcare team will show you how. Then throw away your gloves and wash your hands. You or your caregiver should call your healthcare provider right away if you have any redness, swelling, or drainage around the exit side of your catheter, have a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, or have chills. You should also call if you can't flush your catheter, your needleless connector falls off, your catheter is broken or leaking, your dressing is damaged, dirty, wet, or peeling off, or if you have any questions. If you're a patient at MSK and need to reach a provider after 5:00 p.m., during the weekend, or on a holiday, call 212-639-2000.